Double eyelid surgery is probably the most common operation that I perform. It's a more complicated situation than one thinks, just putting an extra fold, because you also have to take into consideration the shape of the eye. And that means looking at the medial canthus. So if you look at an Asian person who has double eyelids, you will find that there are two kinds. They can become innies, where there's a line that goes outside, and then there's a parallel line which tapers and becomes one line close to the nose. Or you get the shape of the eye and the line of the double eyelid is completely parallel to the upper border of the lash line. So that's what we call a parallel fold. The other one is called an innie fold. Different people will have different outcomes relative to the shape of their inner canthus. So the inner canthus is the medial-most part of the eye, and in some people there's a little bit of skin which comes down, and that's called the Mongolian fold or the epicanthic fold, and that gives a characteristic to the Asian eye. There are some Asians who don't have that fold, and when you look at their eyes, they look a little bit Pan-Asian or a bit Caucasian. So this is a style that is very sought after today, where patients want to look Asian, but they want to look like an Asian who looks a little bit Caucasian or a little bit Western. And in doing that, not only will I be performing the double eyelid surgery, I might perform a medial epicanthoplasty at the same time, so that patients can get this nice, long, elongated appearance with an open canthus here. And you can see that in many movie stars and singers from Korea and China. Now, as for the double eyelid itself, there are two ways of doing it. My favorite technique, wherever possible, is to do a non-surgical stitching method, where I will put stitches through the eyelid and the cartilage within the eyelid and create a fold such that every time they open their eyes, they will see a consistent fold. And this is exactly the same principle as people who put a little bit of sticker tape on their eyelids, and when they open, it opens where the sticker is. Now, there's some individuals who have a lot of fat in the eye, or they're very thick muscle, and even if you create a double eyelid, it looks very thick and is not aesthetic. So those patients may need to have what we call an open procedure, where we remove the skin and the muscle and a little bit of the fat just to recontour the eye. And of course that means an operation, and there will be a scar, and that scar takes time to recover. So you could see a visible scar for anywhere between 6 weeks to 2 months. With the other technique, where we use the sutures, patients can recover and look pretty normal within a week. But as I said, selected individuals do better with the stitching technique, and some individuals, especially the older patients who we see, do better with an open technique. I will usually accede to doing a double eyelid procedure if I feel that it's actually going to enhance the way they look. A lot of that is dependent on what the patient is looking for. If you like this video, please follow us on Instagram and Facebook, where there are other interesting videos that you can watch.